Hi everyone, this is Nimi Tom from Grace Aaron World. In this week, we are going to learn about the most important topic in cardiology, that is ECG interpretation. In ECG interpretation, if we want to learn more about how to identify the rhythms, it is essential to study the cardiac conduction system first. As we all know that the heart has got four chambers, that is right atrium, right ventricle and left ventricle. So when we study about the cardiac conduction system, the main important components are SA node, AV bundle, it is also called bundle of Hayes, right and left bundle branch and Purkinje fibers. So this is the SA node. SA node is situated in the right atrium in the upper corner just near to the entrance of superior vena cava. SA node, it is also called natural pacemaker because it can generate its own impulse and it determines the heart rate. So the intrinsic rate of SA node, that is 60 to 100 beats per minute. When the SA node fires the electrical impulse, it is going to AV node and the electrical impulse which is fired from the SA node, which gives a charge to the both atrium. That means the both atrium gets electric depolarization. That means it gets some charge. Okay. So then the impulse which is going to the AV node, which is situated in the right atrium just to the center of the heart, there the AV node just make a pause, just make a delay. It is called AV nodal delay. Actually, delay, it means like a negative sense, but in this scenario, it's a positive concept because when the SA node fires the electrical impulse, the AV node makes some delay in order to make sure that after the electric depolarization of the atrium, it gives some time to empty all the blood from the atrium to ventricle. That means the AV node is called the gatekeeper for the atrial contraction. That helps to make sure that atrium contracts all the blood prior to the ventricular contraction, the atrium emptying all the blood to the ventricle. So AV nodal delay is a kind of positive concept. So from that impulse which is received from the SA node to the AV node, then goes to the bundle of Hayes. The bundle of Hayes, it has also got its own intrinsic rate, that's same as AV node, that is 40 to 60 beats per minute. Then from the bundle of Hayes, it is then bifurcated to right bundle branch and left bundle branch. It has its own intrinsic rate, that is 20 to 40 beats per minute. Then the right bundle branch and left bundle branch, which is then separated into Purkinje fibers, which gives electric impulses towards the entire part of the ventricle. Okay, there the ventricular contraction takes place. So the cardiac conduction activity we can record it in a ECG strip. It is called electrocardiogram. So in the ECG, we have mainly waves, segments and intervals. Waves, there will be mainly 5 waves: P wave, QRS wave and T wave. The QRS wave, it formed a complex, it is called QRS complex. So let's see one by one. About the P wave, it shows atrial depolarization. Okay, so atrial depolarization means when the SA node fires the electrical impulse, the both atrium get depolarized. So it shows a wave that is called P wave. Okay, Then the another one, that is QRS complex. QRS complex, when the ventricle depolarizes just prior to the ventricular contraction, it forms a complex that is called QRS complex. The another one, T wave, that is ventricular repolarization. Every depolarization, there will be repolarization. Okay, so after the ventricular depolarization, there will be ventricular repolarization and it forms a wave, that is T wave. I'm sure now you might be thinking about where is the atrial repolarization. Actually, in each ECG, there will be atrial repolarization, but physically we cannot see it because it is buried under QRS complex. The repolarization is buried under ventricular depolarization. Okay. Now, we're going to see about the segment. There is mainly two segments, PQ segment and ST segment. PQ segment means at the end of ventricular depolarization to the beginning of ventricular depolarization, there will be AV nodal delay, which we have already seen. So the time taken for that AV nodal delay for a line, it is called a PQ segment. The another one, ST segment. ST segment means it is between the end of the ventricular depolarization to the beginning of ventricular repolarization. It is called ST segment. Actually, in that segment, the ventricles ventricle contracts its blood and emptying the chamber. So that point of time is recorded as ST segment. So when we see more about the ventricular contraction, the ventricular action potential, you can see this image, that is there will be depolarization followed by initial depolarization and there is a plateau followed by repolarization. Okay, so this action potential, when we discussed in the ECG strip, this depolarization is the QRS complex and there will be a small initial repolarization, that is the beginning of the ST segment, and the plateau, that is ST segment. There the ventricle contracts and empty the chamber and followed by the repolarization that forms the T wave. Okay, next about another segment that is called TP segment. It's from the end of the T wave to the beginning of the P wave. Actually, the time between this segment is where the heart muscle electrically silent. Okay, usually it slows down, especially in case of acute pericarditis. Next, we are going to see about the intervals. Actually, there are three main intervals, that is PR interval, QT interval and RR interval. So, PR interval, which includes P wave and PQ segment. The another one, that is QT interval, which include QRS complex, ST segment and the T wave. Okay. And the last one, that is RR interval. If you take the two ECG waves, then you can see there will be two RR. Okay. So between the R to R wave, that interval is called RR interval. We will see more about RR interval in the next class. So far we discussed about the cardiac conduction system, the main components and the ECG. In the ECG, we have seen about the waves, segments and intervals. So the next class we are going to see more about how we can determine the heart rate, and more about the ECG. I hope you guys got an overall idea about the cardiac conduction and the basic information about the ECG. So, see you on the next class. Till then, bye. Take care.